Well, good evening, and thank you everyone for taking the time to join us in our town hall for a very important discussion on COVID-19 and its impact on mental health in our community. I'm so touched and overwhelmed by the support through all the donations we've gotten and the turnout that we have for today. But before we start with our program, we want to remember Dr. Fowler of Victory Mission Baptist Church, Missionary Baptist Church, who passed away this morning. So one of our panelists, Dr. Jacobs, who knew Dr. Fowler, would like to share some remarks.
Yes, thank you, Tran. And yes, I definitely want to take this time to, just to remember Dr. Fowler, as he was such a, a significant voice and really just a pillar in our community here in Las Vegas. And one of the things that I think maybe a lot of people do not realize is that he was very passionate about mental health. In fact, around this time last year, he opened his doors at his church for myself and a few others to come in and do host a town hall meeting regarding mental health. And he spent the entire time participating as well. And this also took place on the same day that Assemblyman Tyrone Thompson had passed away, who was also a member at Victory Missionary Baptist Church. So for the fact that he was able to spend the time and to open his doors with open arms, and that goes to show you the type of person, the man that he was, and how important mental health was. So definitely somebody who deserves all the the recognition. It's unfortunate that we had to, kind of share his, share his memory, with him passing. But he will live on forever. And again, we appreciate you and your importance to mental health in our community. So thank you.
Thank you, Dr. Jacobs. So again, good evening, everyone. My name is Tren Dang, new Executive Director of NAMI Southern Nevada as of January 2020. I was first introduced to NAMI in 2011 as a participant of the Family to Family course, and it was during a time where I desperately was looking for support, and NAMI was there for me. So this organization holds near and dear to my heart, and I'm so grateful to have this opportunity to give back to the community and to hold the space where we can bring the discussion of mental health to the forefront. And so for tonight, our Zoom attendees, questions can be typed into the chat directly to all of our panelists. Other attendees will not be able to see your questions for privacy reasons. For our Facebook Live folks, you can type your questions into the comments section. So we have Katie on, who will be monitoring the Facebook Live section. We will go through the list of pre-submitted questions that people submitted through Eventbrite, and we will take questions from the audience as well. But we will not be able to get through all the questions today. However, we will have a follow-up focus group discussion next Saturday, May 30th, for a more interactive discussion to address some of the concerns from family members and peers. More information will be sent in a follow-up email. So at 10:30 to 12 p.m. on Saturday, we are inviting family members to come have a discussion with us. And from 12:30 to 2 p.m., we'd like to open it up to peers. And with that, I'd also like to discuss some of the NAMI programs that we've been working hard to migrate over to an online virtual platform. So our family support groups has been running for the past couple of weeks now. Our Route 91 support group has just started online as of yesterday, and our Connections peer support group will also be migrating online as of next week as well. So you can visit our website in order to register for the support groups. We also have a family to family education class planned and scheduled for June 1st. And you'll also be able to find the registration link on our website for that. And if there's anyone needing additional support or just needs someone to reach out to, I'd like to let you know that we do have a warm line, the NAMI Western Nevada warm line, that is open to the public. You can find that information on our www.namisouthernevada.org website. It is open Monday through Friday from 8 a.m. to 10 p.m. or Saturday and Sunday from 8 a.m. to 9 p.m. And so next, we'll go ahead and move into our introductions with our panelists. First up, we have Dr. Sheldon Jacobs.
Yes, hello, everybody. My name is Dr. Sheldon Jacobs, and I'm on the State of Nevada Board of MFTs and CPCs, also Vice President of NAMI, and I'm a licensed measure family therapist. and I work for the Clark County Department of Family Services. And lastly, I'm a practitioner in private practice here in the Las Vegas community.
Thank you. We have Reverend Brian.
Good afternoon, everyone. I am an interfaith ordained minister and ordained chaplain for the past 39 years. I'm also a certified pastoral counselor, a mental health and life coach. I'm an emergency crisis response disaster chaplain, and I've been further trained in suicide awareness, prevention, intervention, domestic abuse and violence, substance abuse, human trafficking, grief and loss, and many, many other things, especially with our civilian, military, and first responders. And I'm also on the board of directors, which I'm very proud and privileged to be part of.
Thank you. Next, we have Dr. Brian Potts.
Hey guys, my name is Dr. Brian Potts. I'm a psychologist at the VA. I just want to share that, with my participation in this event, I'm not here on the VA capacity. I'm here as a board member with NAMI. But my role there is I'm the local recovery coordinator there. I'm also a captain in the Utah National Guard. And yeah, excited to be here.
Thank you. Next up, we have Gwynneth Smith.
Hi, everybody. Welcome to the NAMI Town Hall on this really important topic. I'm glad you all could be here. I'm excited to be here. I'm a member of NAMI Southern Nevada's board. I'm also a Chief Deputy District Attorney in the Clark County DA's office, and I work in the Child Welfare Division. So that means I work with kids and families in the foster care system. So we interface with issues of mental health every single day. Prior to joining the DA's office, I was a psychologist at University of California, San Francisco, and I worked treating people with post-traumatic stress disorder. So thanks for joining.
Thank you. We have Andrew DePalma.
Hello all. My name is Andy DePalma. I'm a police officer with Metro. I've been in law enforcement for 26 years now. I am currently assigned to our crisis intervention unit, so we teach crisis intervention to all the officers and some civilians and nonprofits out here. I am also one of our hostage barricade crisis negotiators, and I am the secretary on the board of directors for NAMI as well.
And we have our two moderators. First up, we have Robin Reedy.
Hi, I'm Robin Reedy. I'm the executive director for NAMI Nevada, and I'm probably the least knowledgeable person of anything here, so I'm the moderator.
Not true. Very knowledgeable. And next up, we have Sandy Staymates.
Hi, I'm Sandy Staymates, and I'm the executive director of NAMI Northern Nevada, our Washoe County affiliate. And I found NAMI back in 2001 as a family member. So it saved my life, and I'm glad to be here. Thank you.
All right, and thank you everyone again. So I'll go ahead and take a step back and let our panelists start our discussions with our moderators.
Okay, great. Thank you. Reverend Brian, I'd like to start with you first.
Sure.
Everyone reacts differently to stressful situations. How are you coping with the overall COVID-19 crisis and the loss of your normal daily routines?
Well, thank you. That's always a very good question, since regardless of our profession, this situation we're all going through together kind of brings it back home where you also have to face things yourself. First off, no one likes change. But with the current situation, what it's done to cause me to do is, first and foremost, is to slow down, which is something I had big difficulty in doing. My daily schedule is always so busy that I forgot the important things, important basics of my life. So I've learned to reprioritize my schedule, slow down, enjoy more time with my family, go back and do some studying, catch up on things that I have kind of said, oh, I'll get to it eventually. But of course, we all know in life, eventual never ever gets to go there, maybe 5 years or 10 years later. And I just enjoy the things I kind of took for granted, like working out in the yard with my wife. And plus, she's noticed the fact that she doesn't have to tell me to go work in the yard or mow the yard or take out the trash. I'm doing it automatically. So that's also improving my relationship with her, even though we've been married for over 28 years. So I'm really, really excited with it. But it does help you reprioritize everything in your life.
Thank you.
So Dr. Jacobs, I'd like to ask you, you started off the meeting talking about Dr. Fowler, and there's a lot of grief in this pandemic, not only for those that have loved ones that are sick and those that have passed, but also just the loss of our normal processes. So discuss some grief issues that are going on during the pandemic and maybe how we can deal with them.
Yes, Robin, that's a great question. And I'll say, I mean, it's obviously, I think there's so much uncertainty that's going on right now. And I think that uncertainty when it comes to obviously our economy, for many people, their jobs, when it comes to even those who've lost loved ones as a result of maybe this pandemic or maybe just around the time of this pandemic. And so we've learned that as a result of the pandemic and the fear of spreading the virus, a lot of people have been unable to grieve naturally due to the fear of having large gatherings like a funeral or a large memorial service. And so what's been happening is, that closure that people usually receive from attending a funeral service or a memorial has, in some respects, has been, sort of taken away. And so I think that, it's forced many people to, to grieve differently and to maybe find other creative ways to grieve, the loss of loved ones. And so that makes it very difficult because in some respects, it's not a normal process, especially for what, a lot of us are used to. And some of that has to do with traditions, spiritual or religious, rites of passage or rites or traditions as well. And so it's challenging. And so I think the best thing, my words of wisdom and just some of my clinical opinion is that still grieve like you normally would. I think, trying your best to not let anything else get in the way. So if it's certain memories that you have of somebody or of a loved one, still continue to have those memories and, do whatever, you feel is natural in terms of your own process, because we all grieve very differently. And so I think it's, important to, to understand and to remember that. But, it is very difficult. We're just in some uncharted, sort of times right now. And so I think that the most important thing to remember is, try to keep things as much as possible, the same, even though it's not the same. And just be a little flexible in terms of trying to be as creative as possible. Thank you.
Great. And Dr. Potts, I'd like to call on you. How's the way of mental health services that are being provided by the VA changed with COVID-19?
So at the VA, there had to be kind of a shift or an adjustment based on the social distancing and the quarantine. And so in order to compensate for that change, we had to shift from what was necessarily a face-to-face modality of treatment of care to an online modality. I think for a lot of people that can be very difficult because some people have apprehension regarding teleservices. Some people have apprehension using, online forums like Facebook or anything like that. So for anyone that's maybe technologically challenged, that was kind of a challenge. And so one of the things that we did was we tried to expand any kind of teleservices to what people were comfortable with. The VA has a teleservice available, we call it BBC, but in addition to that, we also expanded it to Skype, to WebEx, to pretty much what people were comfortable with. If people wanted telephonic appointments,
Well, it looks like we lost him for a moment. So sorry, Dr. Potts. I guess one of the questions we've gotten from our watchers or attendees, and it also matches up to a similar questions in what we had from our Eventbrite questions, is can you speak to the new behaviors developed due to the traumatic effects caused by the pandemic. And so since we have people from different aspects, we have it from first responders, we have it from the faith network. So maybe each of you could say, what do you think is the one change to your area? And we'll start with Gwynneth.
Sorry, I had to unmute myself. The classic Zoom meeting problem that I'm still having at the town hall. So I work in the family court system, and the reality is with the family court system, things have really changed drastically. People should know that family court remains open, law enforcement is working, Department of Family Services is working. If you have an emergency where you need assistance of the courts, like for a temporary protective order, all those options remain there, but the way you go about it is very different. So all of our court hearings have basically migrated to what we're doing here now. So many of the court hearings that are considered, quote, non-essential aren't happening or being recalendared. Many of the court hearings that are occurring are happening via video link. And that's an enormous change. It's a challenge for the judges. It's a challenge for the attorneys. It's a challenge, I think, particularly for the families that are involved. But, you know, you learn all kinds of things when you go through a big unexpected situation like this. And I'm sure other panelists also have their version of this to share, which is that, you know, things we never thought would work, there are some benefits to it. And so one of those is, for example, for parents or family members or foster parents to get to court in person can sometimes be quite burdensome. And so for some of the families that we're working with, the ability to join in a court hearing via audiovisual, I think, has been a benefit to them. They have maybe felt that they've had an easier access to the court system. But it's been a huge change. It's been a huge challenge. You know, kids who are in the foster care system have already experienced trauma. They've experienced loss. They've been separated, sometimes from their families, sometimes from the communities that they were a part of. And then social distancing and quarantine and the pandemic add in this whole other layer of disconnection. So we're all trying to do everything we can in these strange times to help kids and families overcome it. But I think there's no question that in the court system, it's been a big change. We're working through it. We are open for business. If you need help, we are available to help you, but it's been a huge change.
So Andy, how would you describe, as a first responder, maybe some of the behaviors you've seen that have changed due to the pandemic?
I know that our calls for service are pretty much seeing an uptick in the domestic violence area. That was kind of expected, I guess, when people are now staying at home and they're feeling all that pressure and they, you know, the stay-at-home order and they can't leave and they have all these financial and economic and other issues going on. So that was kind of expected, but we haven't really seen a major uptick in any of the violent crimes. I know initially crime was down very low when the stay-at-home order came out, but that's starting to creep back up to normal standards as people are starting to get out and about and unfortunately go out and do some bad things. Our barricades are pretty much the same where they were last year, roughly. We are seeing a little bit more some of the mental health barricades where someone's having a really rough day and we have to go and respond to that, versus we get a lot of folks who they know they're going to jail and they just refuse to open a door. So typically that's the majority of our barricades. And right now it's almost 50-50 with the mental health starting to creep up a little bit.
So out in the faith community, Reverend Brian, can you talk about maybe some changed behaviors that you're dealing with?
Certainly. This is a tough time for all of us, and isolation is something that is difficult. A lot of the individuals out in the faith community enjoy going to church and going to the Wednesday night activities. And now that they are basically quarantined where they have to stay home, they feel like they're disconnected. They feel like they're starting to doubt themselves. They're starting to maybe kind of doubt their faith a little bit. And so what we're doing is that we are reaching out, letting people know that still here by telephone, still here by FaceTime and Zoom, and especially those that have difficulty getting around. They're really learning how to use their phones and learning how to use their computers for the first time, and they kind of like it. I had one lady that called me 2 weeks ago through all of this, and half the communication was laughter because she was getting a tickle out of how the fact that she was able to operate that big box that her grandson gave her, and she's never really turned it on. Now she says, oh, I can do all this kind of stuff. So I think we've created a monster with her now. But it's just a matter of feeling supported. It's a matter of feeling together. And you know, situations like this, all of us are going through a lot, and it's not time to doubt ourselves. We're just remember we are all in this together, and we're always here to try to provide support and uplifting each other, and that's what it's all about. And none of us is alone. It would be different if this was really based on 3 or 4 of us, but it's the entire nation, it's the entire city, it's the entire state, and we need to work together. Our DNA is wired where we need to work together. We need friends, we need family, and sometimes I know we can only go and visit family between glass sliding doors or whatever to say hi, but reach out, call people, talk with them, let them know that they're thought of and that they are cared about, because again, we are all in this together.
So in the veteran community, Dr. Potts, what new behaviors are you seeing due to the pandemic and the traumatic effects of the pandemic?
You know, I think mirroring what everyone else has kind of shared, one of the things that I've noticed in the veteran community is, you know, there is a huge emphasis on social connectedness. I mean, through their training, right, having a battle buddy, having camaraderie, those are big parts of the military experience. And so we always try to encourage social connectedness. So making sure that veterans are staying socially connected with the social distancing is a really big thing that we're trying to emphasize on. But I do see that some people are experiencing some difficulties because they're not able to get out and be connected like they normally would with some of their previous veterans that they served with, or maybe some of the friends that they've made here locally. So that is one of the things that we're starting to see.
So I'm hoping my family isn't watching this. So what I've seen in my family is, and even in myself, I'm eating a lot. You know, my fat jeans are now tight jeans, and I'm watching other people. And while I don't think they necessarily have addiction problems, they're drinking a lot because they can. Dr. Jacobs, what are you seeing out in the community due to the pandemic and changed behaviors?
I would say a little bit of both. I mean, pros and cons. So from a positive standpoint, I would say that some of my clients who necessarily weren't too comfortable meeting with me face to face or in person have found a little bit more comfort being able to use technology to have our sessions, if you will, via Zoom. So I've noticed that some of those clients are opening up more to me than when I would meet with them in person. And again, this is a small percentage of the clients that I work with, but I have noticed that some are, you know, opening up more because they feel more comfortable using the technology platforms. And then also some of the families that I work with in terms of transportation, for some was somewhat of a challenge for them. And so now being able to, you know, to meet with them, to have sessions with them through Zoom, that has helped to eliminate that barrier of getting to and from sessions. So it's been another positive. On the flip side, some negatives that I've been seeing is I think a lot of my clients that have, you know, pre-existing mental health related conditions, you know, are having some trouble. I think that psychological safe space is sort of has closed in on them more or less due to, you know, some of the, you know, the isolation that comes from, you know, having to practice social distancing or physical distancing, I should say. And so for some of them, before, some their outlets were being outside and being out and about, and some of that has been taken away because of some of the places that are no longer accessible because of the virus. And so I noticed some more challenges with those individuals because that toolbox that they once had is sort of been cut in half. So they're not able to access all of their coping tools as a result of that. So definitely, there's been some challenges there, but also, they've been able to find some more creative ways to help them cope during this tough time. Thank you.
Sandy, you're on.
Okay, Andy, I'd like to ask you a question. So, it's been a couple months now and we're getting pretty comfortable with staying at home, but now the state is starting to reopen. What are some of the changes you're seeing?
Well, our area commands opened up, I believe, on May 5th when the governor put lifted, the first part of his order. So all of our area commands are open. You're going to have to wear masks. There'll be officers out there taking a temperature. Family and friends that are with you need to stay in the car if possible or stay home. Same thing with the area commands. Those are open. So typically you could go in there with 4 or 5 people and just sit down. And now they're limiting that to just the people that need to be in there. Again, masks will be provided if you don't have one. The records and fingerprint down at MLK, I believe, is 7 to 4, 7 to 5-ish, and our evidence vault is open. But if you go to lvmpd.com or protectthecity.com, either one of them, the first thing you're going to see up on the main page is a COVID-19 update, and you can just click on that, and it'll break down everything, and then there's a bunch of little hyperlinks you could click on for a bunch of different topics that you can read up on.
Oh, good. Thank you. That's very helpful.
Good, we're open.
Good.
So we've talked a little bit about the telehealth, and I know within several days of us shutting down, I had a doctor's appointment, and I figured it was just canceled, and I got a call from my doctor. And I did find that I was probably more open in talking about the issues with him over the phone than I would have been in person, and maybe that's part of the white coat kind of drama you end up with. But after I got off, I started thinking about it, and it was my first telehealth. Do you think that this is going to stick around? And can you tell me, I mean, I know there's a few telehealth availabilities for mental health through UNLV and different sites, but can you tell us about different options that people might have? But is it going to stick around, or will we fall back to where we were? Dr. Jacobs?
I think there's a lot of uncertainty. I think there's a lot that we don't know. I do think that we have discovered that telehealth is a very useful and effective platform, and we also know that individuals that maybe had a hard time maybe seeking services or receiving services due to living in very rural areas. We know that technology has sort of kind of rectified that issue for many. Obviously, the caveat is, there's still a lot of individuals out there who don't have maybe internet access, or who have a low speed, or who have low speed internet, or maybe lack the technological resources. And so, how we're going to, work with those individuals if, they aren't able to, receive in-person therapy or services. So I think there's still a lot of questions that need to be sort of asked and answered. And I think, probably the safe answer to your question is that, there's a lot that we don't know, but I do feel that, when it comes to mental health, when it comes to healthcare, I think there's going to be a lot of changes that are going to be coming down the pike as a result of this crisis that we're facing.
Okay, Dr. Potts, what do you feel in the veteran world? Do you think it's going to stick around? You're going to use it more?
I not just kind of speaking about the VA, but even in my own private practice. I have a very baby private practice here in Las Vegas, and I think similar to what Sheldon said, I've gotten mixed results. For some people, they really love the idea of telehealth. They love the fact that, you know, they can roll out of bed and see a clinician without having to navigate maybe some of the transportation barriers or the timing barriers in their schedule. I've had some people that just kind of fit it in during their lunch breaks. So in actuality, the telehealth aspect has improved their ability to kind of utilize mental health services through their you know, busy days, for those of my clients that are still having an opportunity to work. And so I do think that it will be definitely changing the aspect of mental health services, because, you know, it just makes it a little bit more convenient for the consumer, and also for the provider, right? One provider also doesn't like rolling out of bed in pajama pants. I'm clearly not one of those, but if I was, what provider wouldn't want to be able to be in the comfort of their home and provide mental health services? I think the flip side to that is, you know, you might lose the human connection, which is extremely important and helpful when you're having in-person services. So I can see the benefit to both sides, and kind of similar to what Dr. Sheldon was saying, also the technology piece can also be another barrier. So on one hand, I could see it kind of losing or having some potential barriers with it, but on the other, I could see a lot of benefits with maintaining and having more telehealth services. So I think it'll be interesting to see, but I do think there will be definitely more offerings and probably more utilization of telehealth services.
I think they just like the ability to hang up on you. Sandy.
Okay, I'd like to give the panelists just a little break. I see a question from the audience about what is NAMI doing in face of how have our services changed? And I'd like to speak to that because we are starting to be able to offer our support groups online through Zoom, and we've developed a process so that we can keep our groups safe, secure, and confidential. And I'm also a family-to-family course teacher. And I started a course February 15th, and all of a sudden, mid-March came, and we couldn't meet at the VA hospital anymore for our class. So we had 4 in-person classes, and then we finished the course on Zoom, and it went really, really well. So we had already been together, so we knew each other. But I was supposed to start another course on April 20th. And I thought, gee, could we really start it from the beginning on Zoom? Well, we did. And I just finished last Thursday night because we had it 2 nights a week, and it went really, really well. And the silver lining in all of it was that in our new family-to-family course, we have PowerPoints and we have videos, and we weren't able to use those when we taught at the VA hospital. They have a fabulous system, but we weren't able to use that. So on Zoom, we were able to use all of those technology tools, and it was a great course. So we're changing. And I think even someday when we're able to start meeting in person again, I think we're going to continue using some online support groups.
Yeah, I would say statewide that, you know, we will probably continue. They certainly won't be everyone, but we'll continue to have them for those that are comfortable with it. And, you know, our national programs are working very hard at setting up policies to continue that. So I suspect, even on the telehealth, that it's going to be a merger of in-person and when it doesn't work out, online telehealth type things. And I think that's kind of going to be their approach worldwide, but we'll see. We'll see.
So let me ask another question. So Gwynneth, this is all of a sudden we're all home and the kids are home. And by the way, you may still have to work, but now you have to be a school teacher too. How are families dealing with it? Have you been able to talk with people? How are they doing?
I think that this has been obviously a huge impact on families, a huge sea change for families. You know, in my Facebook feed, as this pandemic has been going on, I've seen a saying pop up a number of times, which is something along the lines of, we're all in the same storm, but we're not all in the same boat. And knowing the families and the children that I work with in child welfare, that's really true. This is an enormous hardship for every single person in our community, but I think there's particularly vulnerable populations for whom it's an even bigger hardship. So families and caregivers that were struggling with mental health beforehand, that were struggling with substance use issues beforehand, or violence in the home or stress in the home. This is layering on top of that. On top of it, I think a lot of the supports that a family or a child or a community typically turns to are obviously not available in the way they used to be. So thinking for kids in particular, school is so enormous in a child's life, particularly children who may have behavioral issues or mental health issues or special diagnoses, and they depend really on caregivers and specialized teachers at school, coaches, faith communities, you know, all of these kind of formal supports that we would typically turn to. While they're still there, they're there in a different form. I think even informal supports are kind of different than they used to be. So we used to be kind of more physically connected to our friends and our neighbors and our family than we are right now. So I think there's a big sense of isolation for a lot of people that can be really problematic for families, particularly that were already struggling, who may have been struggling with issues of poverty or whatever beforehand. And that isolation can sometimes kind of compound it. So I do worry as a DA, as Andy alluded to, as law enforcement, I worry about families where there may be those risk factors for stress or for violence, and now families are much more isolated from their support systems. So it can be more difficult to detect who is it in our community that needs help. And also, as you mentioned in the body of your question, the burden for caregivers is going up because now you're having to play all of these different roles simultaneously. You're a teacher, you're a parent, you might be an employee, you might have lost your job and be profoundly stressed about how you are going to survive and how your family is going to survive through that economic stress. So parents are dealing with all of that, and of course children are hugely attuned to the mental health of their parents and their caregivers. So that trickles down to children as well. So I think what I would say, even though we're in very different times now, I guess the advice I would give is to continue to check in on each other, those in your communities, whether that's a faith community or a school community or just friends and neighbors. Continue to proactively check on people and see how they're doing. If you are struggling, if you know someone who's struggling, if you know a child or someone who might be at risk of violence, don't be afraid to ask for help. That help exists, but we're accessing it in different ways now. And finally, for caregivers out there, whatever kind of caregiver you are, parent or not, you might be a grandmother, you might be an auntie, you might be a foster parent, you might be a mom or a dad. Stay attuned to your own mental health and your own emotional health. And if you need help, don't be afraid to seek help for yourself, because I think that's one of the most valuable things you can do for your children who might also be struggling through all of this right now.
That's good advice. Thank you.
Yeah, we say that in our community all the time. If you don't take care of yourself, you don't have self-care, how can you take care of others, especially family members who take care of someone who lives with a mental health condition? So I joked about, eating and drinking, but obviously there's a lot of people out there who are using substances and or alcohol more than usual. How can you tell when that's a problem? And how, since we're seeing that rise, what should families and that be paying attention to? And then maybe some practical advice on maybe not to behave that way. And I'll just throw that out because you probably all see this from each one of your specialties. So raise your hand if you want to answer first. Okay, thank you, brave Dr. Jacobs.
Yes, that's a tough one. I mean, I think, I've said this before, we're kind of, living, it's almost like, the pandemic within the pandemic. So we have the public health crisis that has been brought on, by COVID-19. And then we also have sort of the ancillary pandemic, which is some of the residual effects that we're seeing with, mental health and domestic violence and substance abuse and financial loss and all these other sort of factors that are sprouting up around, families and communities. And so I think that, obviously it's difficult on many levels. I mean, it poses many challenges for everyone, including myself. Sometimes people think that because I'm a professional, I'm a therapist, that my life is always in order, and that's not necessarily the case. I think, one of the things that, I tell not only my clients, but, friends and family that, trying to stay centered as much as possible, and what that may look like, it may vary from person to person. But for me, one of the things that is significant is, of course, my own self-care, but taking care of myself, and having a routine. And so my routine prior to the pandemic was, exercising. I'm an avid gym rat, if you will. And obviously, the last few months, the gyms have been closed. And so that was something that I wasn't able to access. And when I work out, I feel so much better. I feel, just that enhanced self-worth, those feel-good chemicals in my brain are firing on all cylinders, and I feel so much better. But when I don't work out, I know it's a difference right away. And so the point I'm trying to make is, for many people, we've had to become more creative in terms of how we go about maintaining our self-care. And so for me, with the gym being taken away, I found other ways to kind of help me to manage myself and my own mental health. And that is, running and going on walks around my neighborhood, or going on family walks with my family, things that, I didn't necessarily do all the time before. And so for me, that's been a positive, is more time with my family. Whereas before the pandemic, I wasn't, or I didn't have as much time because I was working all the time. So, so I think, what's important is, how we manage ourselves, how we manage our own, self-care throughout this time, this difficult time. I think is very important. So I encourage people to find some of those things, find some of those, those tools that are effective. Because for many people, exercise may not be a coping mechanism. You mentioned the word gym or exercise, and people get, they may experience some anxiety from that. So I think, one of the challenges is, finding some of those things that are effective, whether it's through reading, if it's taking a nice warm bath each evening before you go to bed, if it's music, if it's, talking to, your loved ones each day, whatever that might be for you. I think, finding what that is. That's kind of sort of my words of wisdom for all those that are listening in today is, find some of those things that can help you to, to feel good or feel better about yourself. And for some of us out there, we may not know what that is. And so the challenge is, trying to find what that is, trying to seek, what that is. And so yeah, this pandemic, just to answer the original question, it has brought on challenges that we never would have imagined. And so I think, one of the things that we need to keep in mind is, again, taking care of ourselves. So like you alluded to, so we can take care of others. Also, routine is a big one. I think that, trying to stick to the same routine or close to the same routine you had pre-pandemic, I think is also very important, because I think, when we get out of routine it's easy to kind of, to get involved in other things, or it's easy to kind of, start listening to some of those vices that we may have. It's easy to, to maybe binge eat or binge drink or engage in some maladaptive behaviors or things that maybe we normally wouldn't have if we were, involved in or engaged in pro-social activities or behaviors. So, so those are a few things just to be mindful of.
So when should someone be worried? Dr. Potts.
Hey, so a couple of things that it's just kind of popping on the top of my head, and I think I'm going to just piggyback off of what Sheldon said. But one of the things that they talk about in kind of recovery, in regards to substance use disorders or chemical dependency, is it's important to identify triggers. Right now, I know there's so much we can talk about with triggers, but some of those triggers are things like boredom, isolation, right, exacerbation of mental health symptoms, unexpected acute stressors. And when you think of kind of some of the big triggers, that is what a pandemic is, right? Like, it forces us to be isolated, right? It forces us to have some kind of unexpected stressor. People did not know they were going to lose their jobs. For some of them, people did not know they were going to be forced to be in their homes, which then kind of limits our social contact. And so it basically is a massive trigger all rolled in one, just by kind of the context of how we're addressing kind of keeping people safe through the pandemic process. And so, I think there is obviously people that use alcohol for leisure or substance for leisure, but I think it becomes a problem when you notice a few things. One, like if we're using it as a coping strategy, that's a huge thing, right? If we're using it to manage our mental health symptoms, if we're feeling sad, if we're feeling down, if we're feeling anxious, and we're finding that we're utilizing substances to cope with those things, that is a big indicator. Another is if the substance use is affecting our relationships. So when we see that it's affecting our romantic relationships, our relationships with our friends and family, that is another indicator. Clearly, if it's also affecting our jobs, that's another indicator. And another indicator is if we're using it just to kind of get through our day, in the sense of withdrawal symptoms or having physical dependency where we can't get through our day without it. A few of those things are ways that we can know that maybe we're utilizing a substance too frequently, and that might be a good time for us to either get connected into other programs like social programs that help with those with chemical dependency, or also is a way for us to kind of reset, recenter, and go back to some of our healthy coping strategies that Dr. Sheldon was talking about. So those are just a few things that are kind of thought bubbles popping up through my head, guys.
So boredom isn't a trigger? Dr. Sheldon, go ahead. Excuse me, Jacob.
Oh, sorry, one thing I want to add, and that is also our functioning. So I think that, obviously with, substance abuse or misuse, I think, one of the things that we also want to look at is impacting our functioning. And the same thing with even mental health, mental health related issues as well. If it's, impacting us. So for instance, if, I'm drinking and it's preventing me from getting up in the morning and going to work each day, if I'm drinking or abusing a certain substance and it's causing me to abuse my spouse, then, obviously that's an issue, but also there's some level of functioning that is being impacted or impaired as a result of the substance use or misuse, right? And so I think, across the board, whether it be mental health, whether it be, substance use, we have to look at, is this person's, functioning being impacted as a result of these conditions or behaviors. Thank you.
Thank you.
Hi, my name's Sandy. I'm addicted to solitaire. With going on with that, Reverend Brian, I'd like to ask you, so what are some coping mechanisms, maybe more positive coping mechanisms? What are you doing to maintain your peace, comfort, and support?
Well, thank you. That's a very good question. In times like this, especially with isolation, it does force us to go ahead and reflect on our own life, reflect where we are with our careers, And with so many people losing their jobs, sometimes it makes you sit back and wonder, well, am I going to be next on the list? What am I going to do in case that happens? And so what I've seen is a major increase of individuals going online with certain schools and universities where they're actually taking this time to go ahead and improve on their current education, improve on the career that they're in. And in some cases, I know sometimes we are stubborn, and I have to agree that I'm stubborn and pig-headed like most of the rest. And sometimes I have to be kind of hit in the side of the head to kind of wake up a little bit. And maybe someone says, well, I really haven't really enjoyed this job. I don't like this career. I don't know if I'll ever have time to go do this or do that. This may be the time that it's being given to you to go ahead and make that change that otherwise you would have the opportunity. So look at things more in your life as to what you would like to go ahead and try to improve on, rechange priorities. Go do things that you would not normally do. I have a workout bike. I got all kinds of stuff. A gym I turn it into one of the rooms here. And usually I'm so busy, and by the time I come home at 10, 11 o'clock at night on long days, I go in there, look at the room. Well, that's nice. I'll work out maybe sometime later this week. And then 2 months goes by and that hasn't happened. Since the pandemic, even though I'm still going out in person doing support groups and various things, I have lost 10 pounds, and I've gained almost 3 inches in size on my arms. So now my shirts are getting too tight. And my wife says, don't keep it up because I don't want to keep calling you Arnold. So it's like, well, I don't want to go there. But it does make you feel good. Do things that are going to empower you, things that you didn't actually have a chance. And everybody's idea of self-care could be something different. Could be to read a book, go walk the dog. And that's a wonderful way to go around, even though everybody's wearing a mask, you can still go around the neighborhood. And also that's a wonderful way to check in on each other, making sure everybody's okay. It gives you exercise, makes you breathe and get the blood flowing and get the oxygen in the brain, helps you sleep better. There's a lot of things that you can do, things that we, unfortunately, I'll just say this, being human beings, we always try to make things more difficult than it needs to be. We always think that in order for us to be entertained, it's got to be expensive, it's got to be materialistic, but actually the most important and fun things in our life are usually free and usually are all around us if we'll just stop and smell the roses, which now this is allowing us to do.
Great, thanks for that answer. By the way, I just was talking to somebody else earlier today, and they mentioned taking online courses, and some are being offered free. So it's an excellent time to do something to improve yourself.
So one of the questions we have is with regard to law enforcement and with regard, you know, we're working very hard at NAMI and throughout the nation to try to decriminalize mental health and mental health issues. So, and we also know the law is the law, and there's not a lot of room for law enforcement or necessarily court systems. But given the rise in domestic violence and given the intensity of the pandemic and what is going on, how are we managing that in terms of, you know, going to jail, or are there other options? And maybe start with Andy first, since that's the beginning of it, and then we'll go to Gwynneth on that.
So I apologize. I was trying to reach out to Milton, who had the great question earlier, and to the woman who was asking about her daughter. But apparently this is my first time on Zoom also, and I thought I was replying to those folks, but instead replying to all the panelists. So I will answer that question right now as best as I can.
Okay.
Domestic violence and DUIs are two of our crimes that are mandated by NRS that there has to be an arrest. So our discretion really doesn't come into play in those two areas. So it hasn't really affected how we approach domestic violences as a whole. I do know that our agency is leaning towards citations for other misdemeanor crimes as opposed to taking folks to jail. Our sheriff just released, I think, 10% of the population a few weeks ago or recently. Low minor crimes, nothing major. And I think that's just because the jail started seeing an increase of positive COVID-19 outcomes, and including our own COs. So to make that environment safer, if we don't have to arrest it, we can give a citation. That's the route that we seem to be going in certain, quality of life crimes that are misdemeanors, trespassing, some of the folks that are out in the roadway, we might normally take that person in jail, now we'll just give them a ticket.
And Gwynneth?
Yeah, to kind of piggyback on what Andy said, and in my world, domestic violence is kind of considered in two different contexts. Domestic violence is both a crime, so there may be a prosecution associated with it. Typically, that's a misdemeanor prosecution, unless it rises to a certain level, in which case it would be prosecuted as a felony. Domestic violence is also considered in foster care cases, in child welfare cases, because it's such a big issue that really affects the well-being of children. Whether it's a child who's kind of physically caught in the middle of an incident, or it's just a child who's exposed to violence in their home and witnessing that kind of thing. We know from research that it really does affect a child's emotional development, in particular to see one of their primary caregivers victimized. So it is something that the court considers very seriously in terms of safety and also in terms of the emotional impact on kids and families. I will say that the vast majority of the time, unless you get up into kind of the felony arena of domestic violence cases, one of the real focuses of the court system, in addition to making sure that people are safe, in addition to making sure that justice is served, one of the main focuses of the court system is really to try to address services to these families, to perpetrators of domestic violence and victims of domestic violence, so that the underlying issues that cause that to occur in a family or household don't repeat themselves. So you'll see court mandated requirements for an individual to engage in classes or therapy to examine what's going on that's causing them to react with violence. You might see a victim of domestic violence requested to do a similar kind of class to really understand, what is going on, that I may be in a relationship where this is going on, and how can I better protect myself and better protect my children. So that was an issue before the pandemic. It certainly continues to be an issue right now. As Andy has said, just the living circumstances that we're all in terms of the close quarters and the really high levels of stress, some families are going to reach the boiling point. And so the really important thing is, number one, for people to feel safe and for people to feel like they have options and help to access if they need that to be safe. And then number two, once that situation has been diffused, for treatment services to really get to the people who need it, so these underlying issues don't reoccur.
Thank you, Gwynneth.
Great. And I'd like to take a little break for the panel again. We have a question about what affordable resources are available for someone who has no insurance, or they have insurance coverage, but it doesn't cover mental health. So we do have some resources. We have our state mental health system. So in Southern Nevada, it's Southern Nevada Adult Mental Health Services. In Washoe County and in the north, it's Northern Nevada Adult Mental Health Services, and rural clinics. And most of them have an assessment and referral thing that someone can walk in, get assessed, see what services are needed, and be able to get those services without having to pay, or it perhaps might be on a sliding scale too. So there are services available. So our state dollars pay for those things through our taxes and whatever, but take advantage of that. Don't just say, well, I can't go because I don't have insurance, or I don't have money. So maybe one of the other panelists would like to add to that.
Anyone else know of any other services that are free or low cost? Sheldon. Mute, unmute.
Sorry, when I was typing, I can't unmute the keyboard. I was trying to respond to our audience.
Yeah, I saw that.
So my apologies. So I would say, so UNLV has two clinics. The practice, which is ran by I think the mental health department, and then, I'm sorry, the Department of Mental Health, and then they also have the family practice, which is ran by the MFT program, or I'm sorry, the Marriage and Family Therapy program at UNLV. So there's two different clinics there where students provide services, and they're supervised by some of the professors there on site, or clinical supervisor that's there on site. But it's a really good resource, and I highly recommend it. So as far as I know, that's the only free clinic that's available here in the Valley. There's other providers, whether it be private practice providers or even some behavioral health agencies that will offer like a sliding fee scale. So for instance, if you don't have insurance, or if you don't have the means to pay out of pocket, they'll work with you in terms of, maybe come up with some type of payment plan to help get people the services that they need and deserve. So they won't turn anybody away due to money. And so that's another avenue, is researching some of the various behavioral health clinics out there, and I can provide some information as well after our town hall if need be.
So one of the questions that we're getting, and there's been a lot of discussion on it, again, we talked about decriminalizing mental health. So someone does something, they end up being incarcerated, whether it's a detention facility or a county jail. And we get calls all the time saying they're not getting the meds that they were on. And part of that is because maybe the meds they were on are not on the formulary that the detention facility contracted with. Sometimes it just seems like they don't want to give them the meds. I don't know. Andy, I've seen that you're talking about some of this. When I first got involved with NAMI, we really pushed CIT and most teams going out. And it's seems like a long way in coming, but it is happening across our state. And that's something that is really helpful. And then we also have Dr. Potts, who wants to say something, I think. So, but Andy, talk about the detention facility and maybe guide people if they're having problems getting the right meds to someone who might be incarcerated.
Okay, so I do know that from a CIT angle, the correction staff actually has their own CIT training. It's based on what we teach in patrol. It's almost the same exact program with a couple of little spins on it that maybe is just for the correction staff alone. When it comes to medication and everything, I'm going to be honest with you. I haven't been to jail in a very long time. I do know that the staff over at the jail nowadays is very, cooperative with certain needs and issues that arise with our inmates. And I think that there is a way to go through that process of getting medication to somebody. It's just, we can't accept it from somebody because we won't know what it is. So it has to be ordered from our, medical staff at the jail, so they know they're getting the right stuff and not something that somebody's trying to sneak into a friend or a family member. So obviously we just can't have somebody dropping stuff off for obvious reasons. But I know that our captain over there is, she's the head of our Metro Mental Health Committee. Before COVID-19, we were meeting on a monthly basis, and we're probably one of the few agencies in the country that do that, where people from legal, from CIT, from our employee assistance program, from the negotiators, from patrol, we have a whole committee that just discusses mental health issues based on what we're seeing in patrol and corrections. So I will reach out to the captain over there and ask her what we can do about this. I don't want to, as much as I want to help this individual out, I really want to avoid using a name or anything like that. So if there is a way to reach out to her anonymously so that I could have a name to maybe call the captain on, and if this woman wants us to do that, I have no problem, helping her out with that. Obviously, for personal issues, I'm afraid of getting information through this forum and then giving that out. So if there's a way to help her out, I'm all for it.
Well, they indicated that they had contacted NAMI before, so if you want to please contact NAMI again, give them your information, they'll make sure Andy gets it. Dr. Potts, did you have something to add to this or a previous question?
I did not. It was an awkward wave.
Well, at least I'm watching.
You are, and it was like a nervous tick. I apologize, guys.
No worries. No worries.
Yeah.
Andy.
Okay, Andy, I'd like to go back to you one more time on the subject of decriminalization of mental health issues. Family members often call. Maybe the MOST team comes out, and I know it is run a little differently in Southern Nevada, or an officer comes, and maybe a family member asks for a CIT officer to come because there's a mental health crisis. A lot of times you get there and you have a choice. Do I take this person to jail, or do I write a legal 2000? Can you talk to that at all?
Yeah, so we teach approximately 10 CIT classes a year, 40-hour class, and we've been fortunate enough that we had some open classes the end of last year and this year. We were able to open that up to other law enforcement agencies in Clark County, as well as nonprofits and private citizens that work in the field if we have the availability. So our patrol level is about 85% are CIT certified. So the odds are pretty high that when somebody meets a parameter of, because our dispatchers have to dispatch calls by parameters, like what is this call made of? What, does it hit this crime? Does it hit that crime? Is it a CIT call? So if it's a CIT call, they will send 1 or 2 CIT officers out on that call. We do have, they have some training in our legal 2000s during our class. And just like anything else, it's, trial and error. And they, hopefully in field training, they're getting a lot of these legals, they're knocking them out. I do know that when we were at Southern Hills for a consortium a few months back, the psychiatric doctor out there, who's the head of their department, made a comment that made me feel kind of good, was that he loves seeing Metro's legal 2000s, because our officers are trained to make sure they're very, very clear and very detailed, not a one-liner that just says depressed or whatever. So they do a very good job of painting that picture of the pain and the suffering and the issue that this person was having, so that the doctor, when they're at the emergency room, can see that, as opposed to just writing person wanted to commit suicide. So they know they're very detailed, and they really get to the heart of what the issue is. Now, we do know that some people are service adverse. We know that some people, when we show up, they're going to deny everything, and for the officer that's there, if it doesn't meet the elements for illegal, they're not going to take that person against their will on something that doesn't meet the requirements. So they're also good about trying to determine if this meets the qualifications or not. Now, in the city of Las Vegas, we've had the crisis response team that was at the downtown area command in small little slivers over by South Central and I believe Southeast, where if a legal comes out or a call that an officer needs some help on, AMR has a rig that has a licensed clinical professional inside that ambulance. Because at the end of the day, we're still police officers doing police officer stuff, but nowadays 60% of our job is stuff that's not law enforcement related. And unfortunately, we don't have the training. Like on this board, it's all doctors, and the Reverend that has like 30 certifications and all these things. Those are the folks that really need to be involved. But as a first responder, we have to have some training. So the CRT is awesome because they can show up, they can take our legal and direct, because NRS is very specific. On a legal, you have to go to an emergency room. We don't have any say in that. We call for the ambulance picks a person up, takes them directly to the ER. The CRT now has the ability, because they have that licensed clinical social worker inside, to say, no, I got in touch with the case manager, because again, with HIPAA and all this other stuff, we don't have access to any of that information, but they can call somebody up and they can work out an arrangement with Desert Parkway, or they can take somebody home, which again, we would never do. So that CRT was doing so well that we actually just started on Sunday in 2 other area commands, in Convention Center and South Central. So those 2 area commands now on swing shift for about 6 hours, we're getting a CRT rig in those 2 area commands as well, with the potential to go, longer. Every area command should have a CRT at their disposal. And, it's costly, but if you look at the front end of illegal and how much that drains the community, and oftentimes the person gets to the hospital and 15 or 20 minutes later, they're being released. They're not being seen. The ERs are too overwhelmed, especially now that people aren't really getting the help when they go to the emergency room. So that's where the CRT is even more important, because they can take directly to a mental health facility or a treatment center or shade tree or home.
Great. And you know what, Andy? We really are trying hard to help. We want to bring crisis centers to Nevada. So there will be another option. Instead of taking them to an emergency room, you could take them to a crisis center. So stay tuned. We're trying.
Yeah, well, that's what NAMI does. We advocate, we educate, and we support. So this is your last chance before we have Kyle, who's the president of Southern NAMI, come on. But give me your soundbite of what you want people to know. We'll start with Gwynneth. What do you want people to know?
A couple of things. I think the first thing is to take a minute to kind of normalize what we're all feeling. I think we've been talking about what are the good things and the bad things that have come out of this crisis, and there's a whole lot of bad. But one of the good things, I think, is that because it's such a stressful experience that we are all at some level experiencing together, it normalizes the experience of mental health a little bit. It normalizes the experience of feeling really anxious or really stressed out or depressed. There's obviously a huge difference between that and a clinical mental health issue, but I think this is something that we're all experiencing together, and it gives us the opportunity to talk about it in a new way. The other thing I would say is, as I've said a couple of times before, don't be afraid to ask for help. Even if your normal support systems aren't there in the way they typically have been, if you need help for yourself, if you need help for someone in your family, if there's someone in your community that you're concerned about, don't be afraid to reach out to them or to reach out to someone else if it reaches that level, because there is help available in the community. The way you access it is a little bit different. You can't just walk down, to the courthouse or wherever it is the way you used to, but help is there, and, keep tabs on each other and take care of each other.
Reverend Brian.
Thank you. I can also piggyback on Gwynneth for sure, and that is, number one, it's okay not to feel okay. It really is. All of us are going through a very difficult time, and it's difficult though for a lot of us because we kind of keep ourselves in our own little bubble in between our 4 walls, and so that's all we can see. That's all we can feel. And based on a lot of people I've talked to, it's okay to reach out and ask for help. It's nothing to feel ashamed about. It's nothing to feel that I am weak and I'm less of a human being. Actually, being a human being is someone that's willing to reach out and not feel bad about doing it, because that's what it's all about. All of us go through emotional problems every day of our life. Every week, I can't tell you how many roller coaster feelings I go through from beginning to end. Doesn't mean I'm less of a person or more of this or that. It just means we're going through day-to-day routines, and we need to understand that we can reach out to each other, we can support each other. Definitely keep your eyes out on other people that don't have the ability to have transportation to go places that are maybe kind of already locked and shut in already, check and make sure they're okay, especially if you haven't seen them for a while, or pick up the phone and call, making sure they don't need anything. But bottom line is that we are truly, I know everybody's heard this over and over again, but we are truly all in this together. And we have to understand that together, we will get through things. Look at all the difficult times we've all been through in our lives, and we're still sitting here. We will get through this as well. Yes, will routines be different? Probably. Life will be a little different, but we improvise, adapt, and overcome. We move forward. We become resilient. And the only way we can do that, though, is with each other. Not isolated, but with each other to move together.
Andy.
Well, this is not really more, this is more of a, you know, me personally just saying a few things, not Andy the cop, but, you know, we have a CIT class going on this week today, and we had Rick Egan from the Office of Suicide Prevention come in, and he brought up a good point that a lot of folks are in fight or flight right now. And our suicide numbers haven't gotten as high as in some other areas, but that's because people are fighting, and we're hoping that they don't choose the flight. So on the heels of that, keep fighting, keep strong, keep doing whatever you're doing. If you have family, friends, relatives, yourself, who does have a substance or an alcohol issue, please reach out to sponsors, reach out to friends, reach out to family, reach out to NAMI. That's what we're here for. Don't let something slide. Look out for each other and just stay connected and stay strong, and we shall get through this together.
Dr. Jacobs.
Yes, so I have, I guess, three points. So my first point is I'm an optimist by nature, and I know we will get through these difficult times. A couple of years ago, you know, we had obviously our 1 October, our mass shootings, and I was amazed by how our community, how our state rallied together and came together, and how we were able to get through that horrible time. And so with that, I feel even more confident that we will get through this tough time, and with flying colors. I think we'll continue to be resilient, and I think we'll also learn from this experience. So that's kind of my part of my second point is I think that there's a lot that can come from this in a positive sense. I think some of the things that maybe we weren't doing maybe to the best of standards previously, whether it be healthcare, mental health, substance abuse. I feel like this time, this crisis has allowed us to sort of readdress a lot of things. And I feel that as a result of that, we're going to come out even better than we were before. And then the other part to that is mental health in our state. I feel like I moved here 10 years ago, and I feel that during that time, nobody was really talking about mental health. I mean, it was happening in silos, but nobody was really talking about mental health, especially on a platform like we are today. And so the fact that we're having this conversation today, the fact that we have some of our local leaders and politicians talking about mental health, and doing all they can to improve resources and funding. And again, it's not where it should be. Don't get me wrong. I think we still have some ways to go, but you have to start somewhere. And I feel that the fact that we're having these conversations on many levels, on a micro level and a macro level, I feel that's a huge positive. So I'm delighted to see that, and my heart remains very warm because of that. And then lastly, it's kind of just going off the point that Gwynneth and Reverend Brian had mentioned. And so I agree. We do have to, come together. We see somebody that's struggling, reach out to them. And I think that the biggest thing is, and I'll take it a step further, so it is okay to not be okay, because, a lot of people are struggling. So it's okay, but it's not okay to not reach out when they need. And so I just want to add that tidbit in there, because I think a lot of people, for different reasons, feel, whether it be shame, whether it be just discomfort, don't want to reach out when they're struggling. And I'm here to say, I think all of us are here to say that, it's okay to not be okay, but please reach out. there's resources, there's support out there. So thank you.
Dr. Potts.
So I just want to start off by sharing that this is an extremely tough act to follow with all of you. I'm so grateful that all of my colleagues, even though we're from different backgrounds, have all shared a very similar message that it's okay to not be okay during this time, and really just advocating that it is important for us to reach out, right? That if you're not doing well, please reach out, connect, ask for help. That is okay. And I think one of the things that I'm kind of finding myself thinking about at this moment is the idea of existentialism. And I promise I won't take too long talking about theories, but the idea of existentialism is that things can happen to us, negative things can happen in our external environment that are out of our control. And how do we use that to create meaning in our lives despite the negative things that are happening around us? And so I think for me in my soundbite, all I want to say is, you know, there are so much things happening in the world that are out of our control, but reaching out, right, doing things that are meaningful to you, whether it's finding projects, connecting with your family members, doing things that maybe you haven't done in a while regarding your self-care, all of those things will hopefully fall in line with your own existentialism as we're going through these times of